Hello, this is Ume, registered nurse. Let's discuss about dementia versus delirium. So, dementia patient has slow onset over month to year, and delirium patient has sudden onset over hours to days. Dementia patient has a normal speech, and delirium patient has slurred speech. Dementia patient has conscious and attentive, and delirium patient is out of conscious, in and out of conscious, and inattentive and easily distracted. Dementia patient has a memory loss. Delirium patient also has the memory loss. Dementia patient has language difficulties. Delirium patient also has the language difficulties. Dementia patient has hallucination possible, and also delirium patient hallucination possible. And dementia patient has listless or apathetic mode, most common. Agitation may also possible, and then delirium patient can be anxious, fearful, suspicious, agitated, or can seem to be careless and reactless. And dementia patient is often no other sign of illness. Delirium patient sign of medical illness such as fever, chills, pain, or urinary problem, and then drug side effects are common. Both of the dementia and delirium patient dementia patient is irreversible, and delirium patient is reversible. So there is no known reason why is having the dementia, but there is a reason to having the delirium. The causes of the delirium, I'm using the mnemonics, is called also delirium. D is stand for drug. It could be side effect from the alcohol, opioids, or antidepressant. And then E is stand for epilepsy or electrolyte imbalance. And then L for liver failure, low oxygen, MI or pulmonary embolism. And I is for infection, UTI, and it could be pneumonia too. And then R is the for retention. It could be constipation and urinary retention. I is for the intracranial pressure, brain injury, encephalitis, and stroke. And then U is uremia. Uremia, this is the fatal kidney disease. And then M is metabolism, a metabolic disease such as diabetes, those kind of stuff. So from my experience working medical surgical unit, I see the patient is alert oriented times for when they have a surgery, and maybe they have some kind of infection such as UTI. I see a lot of UTI infection. The patient is good maybe few hours ago after the catheter in place. Maybe patient has an infection UTI, then they start having confusion, delirium. So that's why we have to close monitor those kind of patient. Sometimes we observe them closely and one, and as soon as they are recover from this infection, so they don't have those symptoms anymore. So that's all. I have a practice question coming up now. Practice question number 1 is: a 68 years old patient is diagnosed with moderate dementia and multiple stroke. During assessment, the nurse would expect to find excessive nighttime sleepiness, difficulty eating and swallowing, loss of recent and long-term memory, and then fluctuating ability to perform simple tasks. The answer is loss of recent and long-term memory, because the dementia is related to the memory loss. We already discussed about it. So this is the correct answer is C. Next one is: which nursing action will be the most effective in ensuring daily medication compliance for the patient with mild dementia? The answer is having the patient family member administer the medication, because the patient with the dementia, they forget everything. They don't know what they're taking, what they are not taking. If they need to take the medication in the morning, they should take the medication in the morning. So maybe they are taking in the morning and then they forget if they take or they did not take, they are taking again. So you don't want it that the patient get double doses or there is no medication at all. That's why is more safety if the family member give them medication, so they can keep in track of the medication they are giving. So this is the correct answer. So next one is, when administering mental health status administration patient that delirium, nurse should do what? Nurse should choose the place without distracting stimuli. So if they have so much distraction, the symptom will get worse. So that's why the correct answer always choose the place without less distracting stimuli. So next one is, the nurse is concerned about the post-operative patient risk for injury during the episode of delirium. The appropriate answer is assigned UAP to stay with the nurse and stay with the patient and reorient the patient, because if patient doesn't know what the patient is doing, if not the patient is alert oriented, they can walk around, they can fall, and then they can have extra injury. So that's why we have to careful that until patient symptoms goes away, one and one, that means one person need to stay with the patient and reorient the patient for the patient safety. Next one is, the one of the patient is admitted to the long-term unit who has the Alzheimer and dementia diseases. So he is wandering around the long-term unit. So what you should do for this patient safety? So the patient needs to stay close to the nurse's station and redirect, because patient is wandering around and they have to redirect and send them back to the room. Next one is, the day shift nurse at the long-term care facility learns that the patient with dementia experienced sundowning late in the afternoon on the previous 2 days. Which action nurse should do? They should keep the window blinds open during the daytime. So a likely cause of the sundowning from the circadian rhythm. So that's why they need to keep the daylights. So the way moving the patient different room might be increase more risk. So that's why the correct answer is the B is for the patient have some sunlights from the window. Next is, after change of the shift report on the Alzheimer disease unit, which patient will the nurse assess first? D. Who developed a new cough after eating the breakfast. A new cough after meal patient with the dementia suggests possible aspiration and patient should assess immediately. The other patient also require assessment intervention, but most urgent is the patient who has new cough after meal, that is the risk for aspiration. Next one is, the spouse of 67 years old male patient has early stage of Alzheimer's disease, tells the nurse that I am exhausted from the worrying all the time. I don't know what to do. Which action best the nurse to take next? The answer is B, C, and E. Offer the ideas for the way to distract or redirect the patient, and then C is teach the spouse about the adult daycare as a possible respite, and then E is ask the spouse what she knows and has the considered about dementia care options, because the patient caregiver may be so much exhausted, so sometimes she also need the break, and then she also need the help to take care of that patient. So that's why we need to help the patient caregiver too. Next one is the old patient is brought to the client by the patient spouse, who reports that patient has unable to solve common problems around the house. To obtain the information about the patient current mental status, which would be the nurse asks patient first, what did you eat for the lunch? These questions helps to learn the short-term memory patient, if they can remember, especially Alzheimer disease patient. So that's why the question answer C is the right answer, and rest of them is not the right answer. Bye bye, future nurses. See you next time.